name is Rahim Gitacho. I'm a registered nurse, also Cedar Crest student. Today I'm presenting flu vaccine for healthcare provider. Very interesting to do these researches. Work in a hospital, I see a lot of controversy between getting flu vaccine, not getting flu vaccine. Really getting flu vaccine, this is a prevent influenza infection. So if I educate myself, I will be able to educate my coworkers, could be complying, it could be decrease infection. So I have to do my evidence-based practical researches. I really like it, and then so I'm going to share with you. As we know, CDC said healthcare workers are the main resources of a transmission influenza infection to a patient and the family. But unfortunately, most of healthcare workers was refusing influenza vaccine. It was CDC is mandated influenza vaccine have to be mandatory for all healthcare care workers. I did researches in different libraries, like I went to San Luke's in Lehigh Valley. I use Sinahol, I use PubMed, I use Google Scholarly. I use my keyword influenza vaccine, flu vaccine, influenza vaccine for healthcare workers, declaration form for influenza vaccine and healthcare workers. It was a lot of resources. I have to limit it. I have to be 8 years. I have to be published in English in 4 articles. And also I have to answer my PICO question. So I commend the choice 3 research studies, which is related to healthcare workers and influenza vaccine. And also answer my PICO question. One of my PICO question is healthcare provider and hospital environment, implementation, reduction influenza infection by compared to other by giving promotion to healthcare providers. This study was 3 studies, like I said, but I'm just going to focus a little bit for each one. The first study is why healthcare workers is not complying for influenza vaccine. So they did a study, okay, could be a different factor, could be education, lack of knowledge, could be perception, previous influenza vaccine, fear, concern. So once they, fortunately, I just have to share, most of the time nurses are not complying for influenza vaccine, doctors they are complying for influenza vaccine. So after they know where's the reason why it's not compliant, so they try to implement the policies to educate all these healthcare workers. The second one is declaration form practice, they call DFP, which is as a form. Once you decide to get the flu vaccine or not decide to get the flu vaccine, you need to sign that paper. If you said yes, they give you the flu vaccine, you still have to sign in. If you said no, you have to tell the reason why you don't want it, and then they tell you the sign and symptom, what happened if you don't get the flu vaccine. If you have any concern, they will explain to you. So it's one-to-one cases. So I think it's a very good program. This study is recommended. This is a declaration from practice. Should be in nationalized. It have to be applied and nationalized. The third study was done in long-term facility for older than 60 years old. They said, let's give the flu vaccine to this healthcare workers and also this patient. And they trying to see the outcome. But finally, in the conclusion, what they say is a study is just giving a flu vaccine will not going to be prevent influenza infection. We have to come up with the other layer, hand washing, hygiene, educated more patient will be combined, not just giving flu vaccine or mandatory flu vaccine and not be preventing influenza vaccination. Recommendation was still CDC believe healthcare workers are the main resources for transmission influenza infection to the patient and the family. So one of the recommendation is education. The second education is educate also hygiene, mask, not to wait until diagnosis study resort. If it's a patient come with a sign and symptom, you have to be put in droplet precaution. Like as we know, if a patient comes with sign and symptom, we do influenza A and B diagnosis, and then that result take a little bit of time. A patient can be contaminated healthcare worker to other patient. So right away have a patient symptom, put an isolation, put a droplet precaution, put a sign in the row. The other patient is if a patient families, if they are sick, should not be visited. If we call with healthcare worker, if they are sign symptom, of flu vaccine, they should not come to work. They have to now wait just for doing a test. The sick policy have to be encouraged. Most of the co-workers, they don't want to call sick because they don't have no sick time. So it's a CDC or all these policymakers, healthcare policymakers, they encourage the sick policy have to be more concerned about the patients of co-worker have to be influenza vaccine problem. In conclusion, I do believe by achieving compliance with healthcare workers' acceptance of influenza vaccine, could we reduce the transmission of the influenza vaccine to the patient, to the family member? I think the education is the main key, and also all this mask hygiene would be another sources to prevent influenza vaccine. Thank you very much. If you have any question, I will be posted this on my discussion board. I can answer questions. Thanks. Bye.